Welcome to Behavioral Grooves. My name is Kurt Nelson.
And I'm Tim Houlihan. Given the strange and turbulent times that we are living through, Kurt and I decided to reach out to some of our favorite behavioral science researchers and practitioners to get their take on the novel coronavirus pandemic that is shaking the world.
These special edition episodes will explore a variety of different aspects of the crisis and our response to each of those aspects through a behavioral lens.
We know that you may feel overwhelmed by the crisis already. It seems every news story, every social media thread, every phone conversation that we have is focused on some aspect of the pandemic right now. While the news and updated information are essential, we're going to take a different tact. We want to try to understand the science behind our reactions and our behaviors and how science can help us cope and move beyond the current crisis.
In each episode, we talk with a different behavioral science expert and get their best thinking on an aspect of the crisis. So sit back, take a deep breath, and listen to our special series on behavioral science and the coronavirus pandemic.
Anurag Vaish is the co-founder and director of the FinalMile in Mumbai, India. They now have offices in Mumbai and Chicago. Anurag brings over 17 years of experience in strategic planning, research, and marketing communication, and he's a hero for developing interventions that slowed pedestrian deaths among commuter trains in India. We are happy to have Anurag back with us on Behavioral Grooves. Anurag, welcome back.
Thank you, Tim. Thank you, Kurt. So it's a pleasure to be back again after a while.
We are excited. You were episode 3, I believe. So
seriously, wow.
This is one of the very first. We're so happy to have you. We do want to check in. I mean, this is our special series on COVID-19. So how are you and how are how's FinalMile doing? How's Mumbai? How are things going for you guys?
Yeah, thankfully for us, we are all doing all right. I mean, we don't have a single case of anybody affected or somebody from their family affected as of now. We don't know. We are tracking very, very closely. So that's just good grace. But apart from that, we do see a lot of pain everywhere. So that's painful. Being locked down is painful, but everybody understands that is the best thing to do. So I hope you guys are all right. You guys are taking care while kind of doing your business.
We are. Thank you.
We're doing this all virtual and staying apart, which, for me with Tim, not too bad. So that's okay.
That's good.
Anurag, tell us about how the FinalMile is addressing any of the behavioral implications of the pandemic.
So in several ways, I would say, but as I kind of believe that with coming together with Fractal now, we are kind of bringing data science and behavioral science together, right? So if you see the COVID world today, it's all about data, right? So there's so much data everywhere. And suddenly everybody is an expert in data, right? So people talk data like as if they understand everything about yields and testing norms and so on and so forth. Luckily, we had something called flatten the curve, right? So that's become like a common parlance. Thankfully, it's a good heuristic. But together, as a data science and a behavioral science team, we are kind of helping the government in many different ways. So, we are kind of developing data tracking mechanisms. We are helping with dashboarding, helping the government kind of see how their efforts are working in terms of containing people and, tracking their movements and so on and so forth. So that is one efficient piece of work that's already started and the governments are benefiting. And I hope as it kind of progresses, we'll get probably a little more sophisticated with how AI kind of is bringing not just information, but also intelligence to the government's decision making, right? So that's one piece. The other piece that just got started day for yesterday is that we started building a pandemic playbook, right? So the idea is that there is really no playbook for dealing with these kind of crises in the world, right? I mean, it's quite evident from how governments are behaving differently. So a German government has got nothing to do with UK and US, and India has its own story, right? So what we started doing was we kind of created a platform where people can plug in what they're seeing in the world from a behavioral science point of view, from an intervention point of view, from an insight point of view, on how governments and people and communities are managing the pandemic, right? In terms of interventions, in terms of risk perceptions, in terms of communication, in terms of specific issues like mask wearing and testing and so on and so forth, right? So that just got kickstarted yesterday. We are hoping that, as we kind of get a lot of, socially sourced inputs into it, potentially for the future, it will kind of start to create a playbook for people to deal with it. And maybe not just pandemic, but crises, it could kind of escalate to that standard. So I'm quite hopeful that it will turn out to be a good archive, an intelligent archive of global efforts, right? Beyond that, we've been putting out some advisories from our side on kind of effect that corporates can bring into play in this kind of a situation, right? So, for instance, we are quite worried about what happens to the delinquency system, right? As in the way people are affected in their credits, we might see delinquencies go up. So we're trying to help banks understand how to use behavioral science to manage these situations proactively and reactively. We are putting out advisories on how to make hand washing a more durable habit rather than something that comes and goes with this particular situation. We are kind of very, very keen to help governments realize how risk needs to be communicated, right? I mean, sometimes we start to think of risk as numbers. Unfortunately, that's not how it operates in our brains. It operates as a feeling, right?
Right.
So, in many cases, I mean, the way Trump speaks, or Modi speaks, or Johnson speaks, right? Everybody tends to kind of use numbers as a way of communicating risk, right? And then the kind of outcomes we see are not necessarily in line, right? So we are very keen that we are able to influence risk communication in a way that it communicates a feeling and therefore draws a response which is behavioral in nature, rather than communicates number, which is just a cognitive evaluation and response, right? So that's another piece of work that's happening. I'm on my own kind of very, very keen that we're able to kind of do something about self-learning in this environment, because online learning by itself is one of the sectors to gain, right? Because all the schools have closed down, all the tuitions have gone out of the business. So people are learning at home. My fear is that as the situation goes back to normal, online learning will also get out of the window, right? So, so I'm trying to help organizations understand how we can use this opportunity to create some durable, preference for self-learning, rather than kind of let it be the way it is. So currently, it's all about access and content. There is really no engagement, right? So yeah, a variety of things. Some data oriented, some social oriented, some corporate oriented, and hopefully some of these will be effective. Right?
Yeah. So, Anurag, how do you think the Indian response has been different than, say, the rest of the world? It seems, and maybe I'm mistaken about this, that the crisis has hit you a little bit later than maybe other parts of the world, China, Europe, US. Has the Indian response been different? Has there been learnings that they've taken on? And what are the unique challenges that are faced in India? Obviously, it's a very different country than the United States. So what are some of those unique challenges that you guys are facing?
The number of challenges in India are like an endless story, right? So from simply a healthcare system point of view, we are not necessarily the best prepared country in the world, right? So our public healthcare and our private healthcare are equally scarce. They're not necessarily bad, but they're quite scarce. It's not widely available as one would like to be, right? And that kind of creates an environment of fear and scarcity, right? So it's scares and scarcity coming together for governments to kind of make decisions in these kind of situations, right? But equally, we have a prime minister now who is highly trusted, who is a great communicator. I mean, one of the finest we have seen in a long while, and who kind of, gets a lot of trust from the population in general. And so he's able to leverage that trust and that command that he has in the polity today to get people to, behave, to people to agree with the policy decisions that are coming to the fore, right? So that is, I think, one thing that's working quite nicely. That we are low on resources is not unknown to anybody. And so hopefully we have been lucky because our numbers are nowhere compared to what we are seeing globally, right? So I think as of today, we have about 6,500 or even less than that number of positive cases. And our testing, I think we have tested close to 100,000, 120,000 people thus far. Uh, the World Health Organization still believes that there is no community transmission that's happening, which is again very lucky that we are still kind of some clusters and some tracing from people who have traveled abroad and so on and so forth, right? So that way we've been lucky. And then the government, I think, took a very good decision to lock down the country. And so we are in a 21-day lockdown right now. And we are in the last few days. So on the 14th, the first 21 days of lockdown will finish. And that, I think, has helped the public authorities to kind of take the due measures to trace, track, and quarantine and, contain zones and identify clusters and so on and so forth, right? I think the government also did very well to expand the testing from just the government hospitals to the private sector, which has run into some trouble now because the Supreme Court came and said that the private sector cannot charge anything, which is awkward because the private sector was charging something like $60 for the test. But that said, I think the private sector contributed to the testing. We now know that some random testing will also start, not necessarily of trace people, but just population testing to figure out if there is any community transmission and if there are situations of people recovering and antibodies developing. So given that the situation is not really as bad on the disease side of things, I think the government is getting the time to kind of put his wares together and put something out, right? On the other hand, there is a social problem that we're dealing with, which is, so many people in India are dependent on daily wages. So they're not employed on a, weekly, monthly wages. And a lockdown, you can imagine how bad it can get for those people, right, who kind of earn on a day-to-day basis. The government has done enough as of now to kind of provide free rations and, drive some moratorium on loans and, free fuel and so on and so forth, right? Several measures to make sure that there's food on the table. But you have to see how the delivery system and the public system makes sure that this gets delivered to people and not just announced, right? So some challenges over there for sure. I was in a government meeting just a couple of days back, and we have our unique challenges, right? I mean, we have a lockdown, and then there are so many communities in India, so many chawls and slums, right, where people use public toilets, right? Don't have their own toilets, right? Imagine social distancing and isolation with public toilets. So those concerns are real. And I think the government is doing enough to sanitize those places by kind of, scrub, kind of using fire brigades and so on and so forth. But the social distancing as a concept is alien to people like us who live in such densely populated environments, right? And so a house which has 12 people living in a 100 square feet house you can imagine what social distancing means, right?
Yeah.
So those are the challenges, but I think either we have been lucky or that we yet don't know. I hope we are lucky rather than that we don't know.
Yeah.
And we're getting the time to kind of deal with it at a pace that we can manage.
Anurag, this is just so wonderful. You've given us so many wonderful things to talk about, but I want to go back to this pandemic playbook. It's really fascinating that you're putting together, it sounds like a global playbook, a global a collection of stories from all countries and observations and tests. Tell me what you hope to gain from that.
I think at the first level, we want to collate, right? So people are observing, So even as something as simple as people drawing circles, right, on the common spaces, saying you need to stand here, right, and you need to keep that distance, right? It's a very simple nudge and a very affordable nudge to drive behaviors, right? I mean, so that's as micro as it gets, right? And at a macro level, we know how governments in different countries are dealing with the situation. We have a German situation, a Sweden situation, a UK situation where behavioral scientists came in and started dominating the discourse, and then they had to kind of backtrack a lot, right? So this is a global playbook. The idea is to get people to contribute to it, so it becomes like an archive, and then we are able to kind of work on the archive to put some intelligence into it, some arrangement into it, some synthesis into it, to make sure that we understand how to kind of create some kind of a rule book or a playbook for people to deal with it, right?
So you want to go beyond just having an archive that is just a record or a journal of things that happen. You actually want to editorialize and say these are some things that worked and these things worked better than others. Is that right?
Yeah, we would like to do that, provided we'll get some data on it, because behavioral intervention data at this time could be fairly random,
Yeah.
because the data focuses all on the numbers of COVID testing and results, and ventilators and beds and hospital capacity and so on and so forth. So I don't know what kind of appetite people have to really put an intervention and then test the efficacy of it to kind of bring some data back. But if that happens, that would be fantastic as well, right? But even in the absence of it, I think the fact that there are a finite number of ways in which people are responding to particular situations, right? For instance, just about risk communication, right? If we could get 20 different ways in which people have seen how risk got communicated, right? We could put our behavioral science, cognitive science hat on it and create some kind of a synthesis, or take it to experts and say, why don't you synthesize and tell us, what do you see in these interventions? Where might there be flaws or hidden flaws in it, right?
Anurag, I want to go on that a little bit because before you talked about, risk is being communicated more as numbers within kind of the general communication that's going on out there. And you were talking about the, risk, we feel risk as a feeling. And so how do you communicate risk as a feeling versus just the numbers? Are you, how are you informing people to communicate that better?
Way back, we did some work with Unilever on road safety, for instance, right? And one of the things that happens with road safety is that when you have an accident, there's a safety officer that files a report, right? Now, the safety officer's report looks like this. It says at XYZ time, so and so was on so and so road, and when he turned left, and some car with number so and so hit this guy in so and then he was taken to hospital. This that, and so that's fact-based risk communication. So we have warned the guy that you shouldn't be ever traveling on a bike without helmets, and we have let him go with some minor reprimand, right?
Yep.
Now, risk as a feeling communication, though, is different, right? It's a communication story that comes from the spouse. So the spouse says, in the morning, I was busily kind of getting things done, and then I got this call which said my hubby or my wife has met with a minor accident, and I was so worried. I just don't understand why my husband just keeps carrying the helmet in his hands and never puts it on his head, right? You know, That's a feeling communication. That's how risk gets consumed, right? Rather than the facts of it. So nobody is saying that we shouldn't share numbers, but how do you kind of communicate the feeling, right? So that the adherence becomes a preference rather than just a mere compliance, right? So I want you to do this is adherence and compliance, right? How do I make it a preference? I want to do this. I want to wear the seatbelt. I want to remain isolated. I want to keep physical distance, right? If people are telling me I'm at risk, I must go test myself. In Bombay, for instance, right, one big problem we have, and not just in Bombay, I'm sure throughout India, is that a lot of people are getting identified as high risk are refusing to get tested
Why is that?
because of the fear of hospitals, maybe fear of knowing the results, fear of feeling guilty, fear of being ostracized by the immediate community. You don't know what, right? But it's not a unique thing. In when you're dealing with HIV in Africa, the fear of test is huge. People would
Yeah.
rather not know than know, right? So,
Yeah,
you
that's
know,
terrible.
so here is where feeling of risk needs to be at a segment level communicated to people, not just saying that people are symptomatic or asymptomatic, right? Think of asymptomatic people from under-resourced communities. What is his
Yeah.
perception of risk? Very different from an asymptomatic or identified as asymptomatic risky person sitting in a well-resourced community, right? Your perception of risk is different, right? So that's what we mean by kind of communicating risk. And so one of the things we did, and that's something that we was testing internally, now we let it out in the market just today morning, is that we have started a emotion research globally, right? Saying we want people to give us 100-word stories, right? Around how they are dealing with the current situation, be it about working from home, be it about keeping themselves safe, be it about dealing with family members, be it about dealing with people who are sick, so on and so forth, right? And we want to emotionally analyze all these stories and hoping that we'll get thousands of such stories from across the globe. And that will also give us a sense of how people are consuming risk and how they are emotionally responding to it. Behaviorally, we have tied them down to a house now, right? So we're not really worried right now because they're in their homes most of the times, right?
Yeah.
But I'm worried when they come out of their homes, right? What happens then,
Right.
right?
Right.
Will we compensate all our, lockdown aggression significantly on the roads and in our behaviors once we are let loose? So hopefully, this research will also give us deep insights into human emotions and their ability to cope with such situations, right?
Well, we would love to share that link to the survey for those 100-word stories in the show notes. Would that be okay?
Yeah, sure, 100%. Thank you
Great.
so much.
Yeah, we'll be happy to get that. So, speaking along these lines, Anurag, if you were to put a crystal ball, some kind of future vision into place, what do you think of the habits that we're starting to take on or that we're having to get rid of? What do you think might continue after the crisis is over?
I'm quite a pessimist about those things, right? I mean, we
You and me
we
both.
know
You and me both.
we are too tightly linked to the context, right? I mean, that's how we are, right? In the current context, there's a set of habits we are displaying, but it's not to say that we cannot, and that's where I think irrespective how much every government today believes that this is a time for authoritative enforcement of regulations, right? And I'm with them. I mean, there is not a time to let loose and say, people do whatever you want to do. That's not the case, right? But there is no case for not using behavioral sciences, right? Which is what I meant when I say today is the context for adherence. I agree. But if you put some behavioral science into it, you might just change that adherence to preference, right? So preference for hand wash is better than adherence to hand washing, right? Preference for, I mean, people are working from home, right? how much bad is it? I think it's a good idea, right? Why should we be getting up every day morning at 8 o'clock and driving 40 miles to go to work when we don't need to, right?
Mm-hmm.
So why shouldn't that become some kind of a habit that days that I don't need to, I work from home, right? How do I get people to buy health insurance? I mean, in a country like India, right? I mean, why will we not get people into the habit of owning a decent health insurance plan, right? So I'm hoping that some of those habits would change, right? But it will require that preference communication. It will not happen if it's all about adherence communication, right? And that's where this whole idea of feeling of risk, the sense of self-image built into those habits, and not just coping, right? Uh, Making it my goal rather than a government goal. So right now, it almost seems like it's a government's goal to manage containment and manage contagion and not letting other people get infected. So I want you to behave that way. How can it become part of my goals, right? How can it become part of my self-image, my impression of the self, right? And I think those are achievable. It's not achievable, right? I mean, if you look at the seat belt example, right? I mean, we know that sometimes when we change our mind, when we start thinking about things differently, we change our behaviors, right?
Yeah.
But what is equally true is that sometimes when we change our behaviors, we start thinking differently about it. If we stand in those circles, we start feeling risk. Not necessarily that we have to feel risk and therefore we stand in those circles. We see people wearing masks, we start feeling risk. Not necessarily that I have to feel risk to wear a mask, right?
Right.
So personal hygiene, public hygiene in a country like India where we spit anywhere, where roads are so dirty, right? Public toilets are the norm, right? Those behaviors, I think, should change. Will require some effort, not just what we are doing right now.
Anurag, thank you. The insights, as Tim mentioned earlier, I think are really valuable here. It's a different perspective. You bring a different perspective, but yet to the degree this is a global pandemic, and as you're talking about this global playbook and the interventions that you're talking about, utilizing, focusing in on feelings as opposed to adherence pieces, having a preference versus adherence, I think are all really great insights. And so just want to thank you for being on, and it's always great talking to you.
Always great talking to you.
you.
Yeah, thank you so much.
Thank you so much. It's my pleasure. It's great talking about it. And I'll kind of send you some notes that we have been publishing. If you find it useful, please do share.
Welcome to the special edition grooving session, where Tim and I groove on some ideas and concepts that were inspired by our conversation with Anurag. So, Tim, what sparked your interest here?
Well, the first thing that Anurag talked about was this idea of India's just beginning, right? It's just starting to bloom in India. And with the high density slums, with the idea that their healthcare system is really not articulated and cut out for this, my gosh, this is it's going to be really interesting to see what happens.
Yeah, the idea too that the Indian culture isn't one to really to buy into social distancing is not part of their social culture. That and as you mentioned, the high density slums that have communal bathrooms. So thinking about trying to social distance or physically distance yourself when to use the bathroom, you have to go and use a communal bathroom that, many other people are using that same bathroom is just the challenges that India is facing are immense, and it's just starting, and the potential for real devastation there is real. So all the work that Anurag and FinalMile and all the other work that they're doing, I commend them because I think it's really vital. The number of lives that can be impacted over there is just huge. And I'm hopeful, keeping my fingers crossed for them that it works.
Isn't some of Christina Bicchieri's work in India, like this whole idea? I think she was talking about the non-use, the not use of toilets, the absence of toilets, and the cultural norms around we're not going to use a toilet. We just go in the field, and we just, we've got places to do that, and that's a problem as well from a public health perspective that gets amped up during a virus like this.
Yeah, you got to think about the idea of if it's already a issue where people don't use the public bathrooms or bathrooms in general because they have some cultural components around it, which as Christina talked about, it was in some of the rural villages that were there that she has done some of that research. With a fear-based pandemic like this, about a virus that it could potentially be spread through contact in those types of restrooms, other areas like that, you got to think that change that they're trying to do to get people to use public restrooms has probably been thrown back a number of years in the ability for them to actually make that change happen.
Yeah, it's huge. Yeah, Kurt, how about you? What were you really struck with?
He said something that is stuck with me in the couple days since we've actually had the conversation with him, which is risk is a feeling, not a number.
Yeah.
And I thought that was really poignant from the perspective that we feel risk as an emotion, that it's a feeling, and it's really hard to communicate that, even when the numbers that we talk about in threatening situations such as this are huge or scary, but that risk assessment part of it is still an emotional response as opposed to a cognitive response, at least the way to get people to change their behavior around that risk, I believe, is where he was going with this.
Well, and we've had this discussion with other guests about distorted risk perception.
Yeah.
And in part, it's distorted because we're not actually making an assessment based on rational or logical or provable facts. We're basing it on emotion, on feeling. And Anurag just hit that right on the nose.
Yeah, I love telling the story about a wife hearing about your accident versus you hearing the numbers about the types of accidents, or maybe even more of a factual basis around that accident. And the difference in a response and the perceived risk that somebody is in, I think is really important there. And so think about that. So how do you communicate feelings? How do you communicate emotions? Right. And I think there's some aspects where you can add in some visual elements. The video is much more, the ability to communicate emotions and feelings in video is much more than probably written word.
Yeah,
the idea of narratives or stories, as Anurag talked about, that story about the wife, and using emotive words, using language that helps convey the feelings that people have in those situations, I think is all of those factors when you're trying to communicate this and to do something, again, to get people to really assess the risk and make a behavior change because of that. So those aspects are vital for us to move forward in helping people change their behavior.
Yeah. Well, and kind of linked to this was his comment about adherence communication as compared to preference communication, right? I mean, this really clever and thoughtful way of teasing out the idea of having people have a preference for the right behaviors versus just the requirement to adhere to the rules.
Yeah.
I thought that was a really important differentiation to make.
Yeah, I like that too, which gets into this concept of reactance that I think we talked a little bit about in some other episodes. But reactance is this idea that, we will push back on things if they take away our personal freedom. So we want things that we cannot have, right? So if it feels like it's taking away one of our freedoms or restricting us in some way, this is regardless of pandemic or not, right? You take something away and you want it more. I remember I had some dental work done, and I'm not a big popcorn eater, but one of the things I couldn't eat was popcorn. And the idea that I couldn't eat popcorn, I wanted popcorn more. It was idiot. I don't not like popcorn, but it's not something I crave on a regular basis.
No.
But just the fact that I could not have popcorn, I wanted that damn popcorn.
Right. Well, this is where laws of prohibition, have failed in the past as well.
Yeah, and so I think there's that idea of, instead of making this, communicating what you can't do and the rules and regulations around this, if we can communicate the preference, so making people want to do the right behavior as opposed to restricting them from doing the wrong behavior,
right?
Then it adds into our ability to keep with this on the long term, because I think also the reactance aspect of this gets stronger the longer that it goes on. I don't know that for a fact. That's just a guess.
Well, it's kind of the difference between, we've often talked about the difference between how a nudge can influence a particular behavior in a particular context at a particular time, but that doesn't necessarily change our preferences. And changing our preferences is a very different thing, especially in the long run. And that's kind of what we need to be thinking about in this pandemic, is changing our preferences, changing the way that we think is a good way to be, the normative self, right?
Yeah. Eugen Demant was talking about how nudges really don't change long-term preferences and social behaviors, whereas social norms, being adaptive and moving and changing, really do have a long-term impact. And I think that's a really important perspective to bring to this. I was also really happy that they're doing this pandemic playbook and these 100-word stories. It was just, again, in all of these conversations that we've had with people, the creativity and the hopefulness of moving forward and trying to use behavioral science for good. I have just been so proud of this community that we are part of, this behavioral science community that is really trying to make a difference in the world, a positive difference in the world. And this is just one more instance where we're seeing people trying to think of, how can we help? How can we make this better? Maybe not today, but in the future moving forward.
Yeah, I saw a piece in the LA Times yesterday written by George Lowenstein and one of his PhD students. And forgive me, I don't remember her name right now, but it's just so, and it was about helping. It was about, people need to feel comfortable accepting help from us. And I thought this was a great, great article. It's just, we might have all these good intentions of, I can go out and help, but part of receiving help is actually being willing to accept it and feeling comfortable that I'm in a place to accept that help. And that's a great example of how behavioral science can be used so perfectly during this time.
Yeah, is helping people ask for help and receive that help.
That's right.
There you go.
That's right.
It's the helping help thing. I don't know how that works.
And it all helps.
Yeah, and it just gets me to think, like, what are some of the other aspects where the behavioral science community moving forward into post-pandemic craziness? What are some of the things that we can start to think about now that we can bring to that post-pandemic that may help either in the getting back into what would be considered normal, or if there are the next pandemic that comes, or even the next just challenge that we face as a society, as a globe, even as a small local community. Yeah, how can we start thinking about that now? What are the aspects that we can do in preparing for that future?
How about planning for the recovery? How about having behavioral scientists at the table when it comes to what my company is going to do to come back to life, to rebuild the company, to get back into business, whether you're a retailer or you're a business that's been impacted dramatically by this? How about have a behavioral scientist at the table to engage in that discussion to make the transition more successful?
Well, you have to think that there's still going to be a lot of fear in in both our consumers as well as employees when they come back into, officing, not from home, but officing in an office, or interacting with customers in a more physical way than they are just via Zoom. So, yeah, how do you transition? How do you ensure that people you're not just ignoring that fear, but you're dealing with that fear, and that you're dealing with it in a way that is respectful and based in science, as opposed to just gut feel? I think that's a great thing to think about. And how are there some guidelines for how to do that? And it's not just fear either. It's this idea of, some people might have felt really discombobulated by being apart, and coming back is this emotional thing, and others maybe not so much. And so different reactions to this. And then there could be anger or confusion about why people are responding differently. So there's a lot of different responses that people are going to be going through once this is over. And then what are the new norms that are taking place? And what are the new norms that you want an organization to have? I think all of those, if you can have a behavioral scientist on call to a degree, or at the table, those are pieces that can be really beneficial. I think going even a step bigger, one of the things is, the global community of behavioral scientists, I think, is getting more connected in this time. We're learning things from different people from around the world. Obviously, our talk with Anurag in India, us being in the United States, we've had conversations with people in England, a variety of people from around the world on behavioral, Iran, from around the world. I'm hoping that those global connections stay, and that we start learning about how different cultures and different societies are responding to these situations, and taking that insight into our overall response. So it's not just U.S. specific based responses or European based responses, that it's a global response. And I think those connections can only be beneficial in the long run. And yes, we've always had them. We've been talking with people from around the globe since we've started this podcast. But I think, and the community itself is global and is connected. But I think even having a greater connection to that global piece is really important as we do this.
Well, I wonder how much of it is not just the global connection among the community. The scientific community has been generally together globally, but it might be connecting the global scientific community to the global business community, to industry, to the applications of the science.
Yeah, I love that. And so I think there's a piece there. And, if the next pandemic comes out, what about having a behavioral science rapid response team that takes a look at this? Because again, behavioral science is so context driven. And so whatever the next pandemic or major global crisis is, there's going to be contextual factors that come into play. So that, yes, as Anurag is creating this pandemic playbook, I think that's important, but that pandemic playbook is going to have to take into account the contextual aspects that are in place at the time of whenever that pandemic comes. And that's where I think behavioral scientists can really add value, so that it isn't just this 20-page playbook that, all right, it's happening, we open up to page 1 and we start going through the checklist, because we may have to adapt that checklist given whatever is going on in the environment, society, the way that things are being transmitted and communicated. We may have to take into account some variances and shift those out to conform to the specific contextual aspects that will make a difference.
So those who adapt will be around to have their DNA in the next generation, right?
The evolutionary aspect of this.
Yes.
Oh, well, with that, again, I think this was a great conversation with Anurag. Love reconnecting with these guests that we've had, across many years now, and really, getting back and seeing again all of the great work that they're doing. And Anurag is no exception to that. you for listening to the special episode of Behavior Grooves. We hope that you found it interesting and insightful. If you liked it, please let others know. We think that the topic is important, and maybe we can help in educating people about how behavioral science can help us all out in this current craziness that we are going through.
Also, please let us know if you have any thoughts or ideas that would be helpful or that we could share. You can reach us through the Connect tab on the Behavior Grooves website at www.behavioralgrooves.com or through Twitter. I'm at T. Houlihan and Kurt is at What Motivates. We really do love hearing from you, and this topic is one that spurs lots of emotions and thought.
As part of our mission, we want to expand and inform the community of people who think about positively applying behavioral science to life. One way that happens is through leaving reviews. If you think this podcast is beneficial and should grow, we would really appreciate to leave a review on Apple Podcasts or whichever podcast server you use.
It only takes a few minutes and goes a long way to boost us in the algorithms that are used to generate search results.
Also, please check out the show notes. We are linking to a number of resources, articles, podcasts, newsletters that we've vetted to bring good facts and ideas around COVID-19 and the coronavirus, its impact, and ways that we can help slow down the spread. There is a lot of information that's being pushed out to everyone each day, and we are weeding through it to find good stuff so that you don't have to.
We truly appreciate you listening. Now go out and wash your hands.